So everyone's going to hit the got it, and we're all going to get through that together. So recording is starting now. And I'm so happy to have you all here for the YWCA's Stand Against Racism event today. Before we move any further, I would like to acknowledge that while this is a virtual meeting, the YWCA White Plains and Central Westchester is on Lenapehoking, which is the Lenape name for Lenape land. That land spans from Western Connecticut to Eastern Pennsylvania and the Hudson Valley to Delaware, with Manhattan at its center. Due to centuries of colonialism, perpetuated by genocide, forced displacement, and systemic oppression, today the Lenape diaspora is dispersed throughout the United States and Canada. The Lenape diaspora includes 5 federally recognized nations in Oklahoma, Wisconsin, and Ontario. And right next to that, if you are able to see my screen, you'll see a very recent article, a snapshot of it. You can't click on it and get access to it, but a snapshot of it from our local news, LOHUD. And the headline, "A New Obstacle for Chappaqua Schools at Button Hook Development, Native American Artifacts." And I just offer this snapshot because while we have acknowledged that that the Y lives and many of us live and work on unceded Native land, there's no active energy around giving that land back, reparations for the displacement and the brutality on the people who have stewarded that land as first peoples of this nation. And today, in 2022, we discuss the opportunity of learning more about these people, of understanding where we come from as an obstacle to school development in a place called Chappaqua. Just want to bring it up for our own observation, for you to self-reflect on how all of this information is resonating with you. What are you observing in your own thought process about that? Now, if you do actually read the article, especially the video in which this woman pictured here, Terry, speaks, Terry does talk about the opportunity to educate and the opportunity presented in finding these artifacts to know more of our truth and history. So I applaud Terry and LOHUD for capturing that, and also call to question the headline, which often hooks us in to get our attention. And so pay attention to where your attention goes and how you respond to stimuli seeking your attention, especially as it relates to race, racialization, racism, and racial equity in our county, in our country, and yes, even in our world. With that, we're going to keep it moving right along. And as I mentioned earlier, I am so proud to be able to take a look back.
I'm good. How are you?
Just ask again that everyone mute. Take a look back at where we've come just from last year. Last year, we had both an in-person and a virtual ribbon cutting for the Westchester Center for Racial Equity. During our Stand Against Racism in 2021, in which we declared racism a public health crisis. I want to just take you through some of the things that I'm reflecting on and invite you to join me in celebrating about the center 1 year in. When we first started, we looked at having 5 pillars on which the center would do its work. It would be a hub, a dedicated space and place to learn, share, experience. It would be a site for training, both for individuals and for organizations. We'd offer workshops and sessions and coaching. It would be a place for leadership development, existent already at the Y and continues to be, our GEMS program for girls, Y leaders. And we were also going to work with nonprofit boards on board development. Signature events would include this event, Stand Against Racism, Reading to End Racism, which continues, and Courageous Conversations, which also continues. And community accountability would include work around advocacy and our racial equity scorecard. Here's how we look today. And I will take full credit in some regard for this shift, not for this image. This image was designed by someone much more talented than I am. But I will say this foundation that we're building now, since I've come on in August, is really about the importance of centering racial healing as a critical tool, an important part of the process for working together individually and across organizations to achieve racial equity. Racial healing makes this sustainable. Racial healing allows us to undo the harms and traumas that racism impose on our lives. Whether we are aware of them or not, it brings it to the surface so that we can do something with it. And it helps us to build a culture for anti-racism. Also, you'll see, or I can point out for you, some of our pillars include things that have shifted as well. One of the things I'm really excited about and we'll touch on later is in the pillar of leadership development. We're looking to invite people to work with the center for a period of time to stretch our imaginations and engage us in different ways about how we develop our own selves. What does that look like? Perhaps a scholar in residence, an artist in residence, a writer or author in residence. We want to make sure that as we do the work toward achieving racial equity, we remember that we are whole people with culture and language and expression. We're not only employees in workplaces in need of DEI training, which is important and we should seek out, but also what does that mean for me as a parent? How do I transfer those skills and concepts into the way I raise my children, into the way I engage with people in my church community? So we're really excited to be able to think broader and more expansive about how we can center racial healing, achieve racial equity, build a culture and community for anti-racism work, not only in how we see ourselves as employees, but in who we are as whole people. Now, people love numbers, and I do too. So let me share a few with you. Four major public events: our Human Rights Day in November, our National Day of Racial Healing in January, which came right after a great program for Martin Luther King Day. And following that in February, we had the Black History Month program featuring local historian from Scarsdale, Jordan Copeland, whose work is great and you should all look it up on YouTube. And then we have today's event, so it's actually 5, another Stand Against Racism event. 14 represents the organizations and the businesses that have trusted us and reached out to us to partner with them and become clients in taking a racial equity, anti-racism journey. We have provided for these 14 clients workshops, trainings, facilitated conversations, and in some instances, coaching. We are so proud to be partners with you, and we look forward to future engagements, and we invite other organizations to reach out to the Westchester Center for Racial Equity at the Y to be a support in the same or other ways. 222 subscribers to Roundup, our new e-monthly newsletter. If you're not in that number, please consider joining. I'll be sure to put links in the chat soon. 30 plus. Now that's a fun number. I'm gonna have to look up what that one is. I believe 30 plus refers to the number of speaking engagements or other facilitated conversations we've been able to have with folks. And more than 1,200 people join with us, the YWCA in Yonkers, and the United Way Westchester and Putnam in the racial equity challenges, the social justice and equity challenges that we collaboratively offer to the community year after year. So those are some of our numbers, and all together in aggregate, 4,200 engagements with people over the past year through the center. We are so proud and so grateful. We're powered by people. And I just want to take a moment over the year, as we reflect on the year, to really honor the people who have played a significant role in the center's celebration of its year of existence. First, we have former CEO of the YWCA, White Plains and Central Westchester, Maria Imperial. We also have former Racial Justice Coordinator and Director, Ariana Quinones. Without them, so much of this work would not be possible today. And even with that, I also want to honor Julia Nesbitt, former HR director and Racial Justice Initiatives coordinator at the YWCA as well. It was such a pleasure to come in and hold on to the legacy that these individuals have built and to continue to build on their work as the director of the center today. I'm also so pleased to have as a co-conspirator in so much of what happens here at the center, Danielle Ferry, who is currently the interim co-CEO of the Y and also the Chief Mission Impact and Advocacy Officer here. There's my face, familiar, and also a face you may not know if you're not signing up for our workshops, is Dr. Jennifer Lewis. Dr. Jennifer Lewis is a trusted partner and support to the Center for Racial Equity. She also facilitates our Racial Equity 101 to 103 series and works closely with some of our most engaged clients on the organizational development consultation they need to advance their equity initiatives. There are so many more colleagues at the Y, so many more faces and partners and friends. And I also want to take this moment to acknowledge the board of the YWCA, White Plains and Central Westchester, and the advisory board of the center, and the table of chief diversity officers across the county who have provided insurmountable guidance, support, and encouragement. Of course, no thank you is done without a thanks to our funders and supporters, Regeneron, Westchester County Government, including the Board of Legislators, PepsiCo, United Way of Westchester and Putnam, Morgan Stanley, No Studios, and that position there of Nonprofit Westchester is not accidental. What an anchor in partnership and support Nonprofit Westchester has been. These are the founding funders of the center. And I would love if you could just in the chat, join me in the thank you. Join me in the support of these people in these organizations, when it came time to put the money where the mouth is and walk the walk, talk the talk they did, and joined us in launching this center into its true manifestation. So grateful for these and others who have come on since. Key Bank, White Plains Hospital. We also acknowledge what continued support means, what renewed support means, and to Regeneron and the Westchester County government in particular, what increased support means. We are so grateful. Coming up, we have our Racial Equity 101 to 103 series. They will be offered virtually on Wednesday evenings and in person at the Y Activity Center on North Street in White Plains on Saturday mornings. I sincerely hope you consider joining. You will learn something new. You will be inspired to continue your learning, to understand racial equity from an anti-racism lens. And it will be really fortuitous for you to share this with your friends, families, contacts. We'd really like to reach full capacity as soon as possible. And full capacity is only 25 folks per session because of how deep the work goes. So be not afraid, join, follow your intuition and curiosity. We are really looking forward to having a new class of graduates from this workshop at the end of June. And we also have 2 new programs we're launching. One, I mentioned earlier how excited I am to have an artist in residence, and we have one in the Harrigan Educational and Cultural Center, a longtime provider of arts and education throughout Westchester County, based in Mount Vernon, New York, and led by Dr. Joyce Harrigan. We are going to infuse and connect racial healing and anti-racist conversation with dance, and you're going to want to be a part of this exploration. You don't have to be an expert or have any experience in dance to participate, nor do you have to be an expert or have any experience in anti-racism to participate. This is a really intentional space for exploration and for shared learning and meaning making together. So join us for that. We'll have open houses on May 10th and May 17th at the YWCA at 7 p.m. in the dance studio. More information about that will come your way. Also, in October, we're launching a virtual speaker series for Diversity Week. I can't wait to share more information with you about this too, but so far we have confirmed as speakers Marco Davis, who is the president and CEO of the Congressional Hispanic Caucus Institute. We also have Minda Harts, award-winning author, speaker, and advocate for equity in the workplace. And we have joining us Monisha Kapila, who is the founder of Pro Inspire, the home for equity in the center, providing invaluable support to organizations and individuals about how to deepen and strengthen their racial equity knowledge, competency, and operation. She gets really good on the how do we do this. So you're not going to want to miss this Diversity Week speaker series coming up in October. With that, I am so glad to turn the attention over to our panelists for today. Kathy Ko-Chin is the CEO of Jasper Inclusion Advisors. We are also joined by Ivy Kam, Director of DEI Sciences at Regeneron, and Laura Rossi, Executive Director of the Westchester Community Foundation. We are going to engage these amazing speakers who I invite to join on camera at this time in a conversation around data and what it means to have an anti-racist approach to data. So before I stop sharing screen and we see our amazing panelists in the virtual flesh, I want to get clear on grounding some definitions so that we all know what we're talking about together. A working definition for racism, if you've ever had the opportunity to engage with me in this conversation before, which some of you have, is that it robs us of our humanity. Racism is a system of advantage based on one's race, and that racism is a system of oppression based on one's race. Racism is different from racial prejudice, hatred, or discrimination. Racism can be internalized. One can feel internally racially inferior. One can feel internally racially superior. Racism can be interpersonal, institutional, and systemic. An anti-racist is someone who is supporting an anti-racist policy through their actions or expressing anti-racist ideas. This includes the expression of ideas that racial groups are equals and do not need developing. Anti-racists argue that racist policies are the cause of racial injustices. And therefore, anti-racism is the work of actively opposing racism by advocating for changes in political, economic, and social life. There are many other variants and interpretations of these definitions. I'm just offering some for us today as we listen to the panelists for our consideration. Now, data refers to distinct pieces of information, usually formatted and stored in a way that is concordant with a specific purpose. Data can exist in various forms, as numbers or text recorded on paper, as bits or bytes stored in electronic memory, or, and this is my favorite personally, as facts living in a person's mind. While data is a collection of individual statistics or facts, information is knowledge gained through research, study, instruction, or communication. Data on its own might not have any meaning and might need to be sorted, analyzed, or interpreted to become information. I want to let y'all know, just in case, I can't see you because I'm sharing screen, but just in case you are scrambling to write these down, I will share these slides with you after the presentation, and you can come back to them, you can challenge them, you can refer to them in your everyday work and in your personal consideration. I should have said that at the front, sorry. So with that, I will stop sharing and I will bring to light here Kathy Ko-Chin first. So let's add this spotlight. Hello, Kathy.
Hello, Maria. So good to see you.
So good to see you. I am going to kick us off here as the time continues to roll, but we're not going to worry about time. If anyone saw me at Nonprofit Westchester's event on April 7th, time is our friend. It wants to be used well by us. But Kathy, folks will be reading your bio in a second, but there's one thing I really want to pull out, and that is, recently 90 federal agencies released equity plans. And I know you played a role in the successful advocacy to establish a White House initiative for Asian Americans, Native Hawaiians, and Pacific Islanders. So thank you for that. And this initiative prioritizes disaggregated data. And can you share with us what your experiences advocating for disaggregated data have been like, specifically to improve outcomes for communities of color?
Thank you, Maria. And first of all, thank you so much for inviting me to be on this esteemed panel. Congratulations to you and the Center for Racial Equity. What an exciting anniversary and all the leadership that preceded you, as well as your incredible leadership. And it's such a delight for me to be with you again, someone I respect and appreciate so much. So thank you. Thank you so much, Maria. Before I begin, I want to mark that today is the 30th anniversary of the LA uprising, in which LA burned in the aftermath of the Rodney King verdict. For Asian Americans, and specifically Korean Americans, it is also known as Sai-i-gu, the day LA's Koreatown burned to the ground. Literally a nation away from where you all sit in New York, LA's Koreatown has been the heart of the Korean American community in the US. Since we are at the Center for Racial Equity event, it is important to mark this somber anniversary in American history, and especially in the history of racial equity. There are many racial dimensions to this story and this anniversary, and we won't be able to get into them today. But I want to mark this moment, how important it is as a milestone across all of our communities, across all communities of color, and how our communities of color have stood up, showed out, and unfortunately not always advanced the vision of Dr. King's beloved community. Maria, thank you so much for the question. At heart, I'm actually a data geek. I love data. And disaggregated data for me is really personal because it's really, really close to my heart. I really appreciate all the definitions you provided, and the one for data is super important to ground our panel today. It is bits and bytes, but it also exists in memory and lived experience. Let me go further to talk more about disaggregated data and data equity, just as you asked. For me, the place to start is from your own Center for Racial Equity's website. And I quote, "Racial equity is the condition that would be achieved if one's racial identity no longer predicted in a statistical sense how one fares." So right there, referring to statistics is the importance of data. So I applaud you for being data-driven and data curious. Many times, the data we need to reveal racial disparities, as well as racially based assets, is just missing. That's what we're striving to see. Color blindness is fictional and actually harmful. It pretends that 400 years of history never existed and doesn't weigh upon our psyche today. As the eminent John Powell has made more visible to all of us, unconscious bias is the air we breathe, the water we swim in this society. So pretending to be colorblind is to deny any of us our agency. So how do we approach seeing color? One way is through data. Another way is through storytelling. Together, they can move hearts through storytelling and minds through data. This is why disaggregated data is so important. It's only through smaller bits of data and aggregated, organized in a different way, that we can really understand what is happening in our communities to our people, meaning everyone, but viewed in the right sized groupings and packets of information to be useful to support each of our full humanity, both our needs as well as our gifts. So I appreciate Maria's clarity in giving us definition, and here are three more. One, to aggregate data is to compile and summarize data. To disaggregate it is to break down aggregated data into component parts or smaller units of data. Two, disaggregation is the breakdown of observations, usually within a common branch of a data hierarchy, to a more detailed level, to the level at which the detailed observations are taken. Let me interpret this a little bit, which is, it means that the collection of detailed data is the critical first step. And third and last, what does data equity mean? The term data equity captures a complex and multifaceted set of ideas. It refers to the consideration through an equity lens of the ways in which data is collected, analyzed, interpreted, and distributed. Because we don't have all day, although I'd love to talk all day about data, let me answer Maria's question a bit more directly. Just to help locate everybody, the White House Initiative for Asian Americans, Native Hawaiians, and Pacific Islanders works across the whole of government, emanating from the White House. WIANPI, as we call it, is a linchpin to advance disaggregated data standards, as well as the collection, analysis, reporting, and dissemination of information, which is disaggregated by race and ethnicity. And for many of us who come from language minority communities, hopefully by primary language, in order to advance equitable policy and programs for all Americans. And then for WIANPI, a focus on what Asian Americans, Native Hawaiians, and Pacific Islanders. This work includes working closely with the White House Office of Management and Budget, OMB, and the US Census Bureau, as well as all of the 13 federal agencies who are charged with collecting, analyzing, and reporting on public-facing data and services. Within WIANPI, they also have an interagency working group, which works across all 23 federal agencies, so that WIANPI can work with individual agencies on how to improve their data standards, as well as collection, analysis, reporting, and dissemination. Moreover, WIANPI, through their regional network, through federal regional offices and partnerships at the state and local level, such as with state and local AAPI commissions and offices, WIANPI can also advance data standards at these other levels of government. During President Obama's second term, I was a member of his advisory commission for AAPIs, the citizen companion to the White House Initiative for Asian Americans, Native Hawaiians, and Pacific Islanders. It was there that we were able to eliminate for the White House and Office of Minority Management and Budget the importance of disaggregated data. Let me share with you the example that we used. And just to, again, to kind of locate us, just a few weeks ago, President Obama returned to the White House for the first time to celebrate the 12th anniversary of the signing of the Affordable Care Act, signed on March 23rd, 2010. So if we go all the way back 12 years, at that time, the rates of lack of insurance aggregated by race, kind of clustered only by 5 racial categories, showed that AAPIs had the lowest rates of uninsurance, the highest rates of coverage, with Latinos having the highest need, lack of insurance, at 22%. At the time, I was the CEO of the Asian and Pacific Islander American Health Forum, which we call the Health Forum, which is a national policy and public health organization. We disaggregated the data and found some revealing and alarming information. Instead of having just 5 big bars showing the aggregated data, for AAPIs, we showed 23 different bars by ethnicity. And the highest rates of uninsurance actually for the whole country were among Korean Americans at 23%. The next bar was 18% for Bangladeshi Americans, and then it was 17% for Pakistani Americans. And then we saw that the rates and the curve of self-employment and small business employment mirrored exactly that of the lack of insurance, at 22% for Koreans, 17% for Bangladeshi, 16% for Pakistanis. And when we think back to Sai Igu and all the small business owners in LA's Koreatown, as well as the bodegas in major cities, this is also part of all of our lived experience, that many of those small shopkeepers are from these communities. They couldn't afford health insurance for themselves, their families, and the few workers they had. So armed with this data, the Health Forum partnered with 2 other national organizations, APCHO, the Association of Asian Pacific Community Health Organizations, and Asian Americans Advancing Justice, to build a network of 70 community partners in 23 states to enroll 1 million Asian Americans, Native Hawaiians, and Pacific Islanders in health insurance over 4 years. We targeted those communities in need because we could see the need. And we did the enrollment assistance in their languages because we could understand which communities were most affected. Our network did the enrollment of half of all the AAPIs who enrolled over those first 4 years in the Affordable Care Act, and eliminated any disparities in coverage for our communities. Now, after the first 4 years, the gap expanded a little bit more, but I think that's a different topic. So as you can see, armed with disaggregated data, really trying to understand both assets as well as needs. This is the power of disaggregated data. Thank you again, Maria, for having me here.
Thank you so much, Kathy, not only for the work you do, but the way that, you know, even I was able to follow along and like, yes, this is why, pulling it apart. And so I'm thinking even in my own experience, something I think I shared as we were prepping for this panel, is that I'm learning too, right? The importance of looking beyond what we can see, right? Looking beyond what we can see to really, really investigate what's there and what do I do with that when I find it. And that's really how I think about an anti-racist approach to data is I've got to have the curiosity. I love data curiosity. Kathy, I'm putting it on a t-shirt and I'm wearing it out all summer. I've got to have the curiosity to say, I've been presented with some information and I'm curious about what else is there. Right. And so what I recently learned is that one of the inheritances of the enslavement of African people still being lived out in Afro-Caribbean people, which I am, right, is that our bodies we're living an endemic reality. A gross majority of Afro-Caribbean people are unable to metabolize salt, leading to hypertension, and sugar, leading to diabetes. And we have a unique blood profile that renders us amenable to medication that is designed to address those ailments. And so being an Afro-Caribbean in this new world, right? When people want to say, oh, we got this many Black people to be a part of this research, and so it's good. Now my ears are perking up a little now, and I'm like, well, which Black people? You know, and then sometimes we get nervous about asking the question, but we've got to be curious and willing to look at what are the answers, not just what they are, but how did we come to them? So I want to thank you for giving us that really masterclass in 10 minutes or less on that disaggregated data and its power, right? When we're able to take that work on and how we can use it in our advocacy for the needs of our community. Also for reminding us of this day and what it means to so many, not only in your community, but in our country, right? What this really meant for so many of us. And I just want to thank you for being here. It's so good to see you again. We should not wait until the next census to do more work together.
Yes, absolutely.
So
Well,
thank you so much, Kathy. Thank
you,
you.
Maria. And send me one of those t-shirts too.
I will. I mean, I'm gonna have to attribute it to you. You know, I pay the people, so we're gonna have to make sure you get your royalties. um, I'm gonna bring into the conversation Westchester's own Laura Rossi. And Laura, so we're hearing this national story, right, about data. And what we know is that quite often our local data is sourced in that national data, right? So some of it we collect and analyze, and some of it is our own county level work that we do. We rely on other people as well. But can you just tell us a bit, some folk, I don't want to assume, some people may not know why the Westchester Community Foundation is here to talk to us about data. And so I would love for you to share the journey that the Westchester Community Foundation has been on in launching its health index and in now evolving that into a community indicator project. And if you can also share what we can expect to see from this new project and what excites you about it under this theme of an anti-racist approach to data.
Thank you, Maria, and congratulations on the 1-year anniversary. This is wonderful for Westchester, very, very exciting. And hello to everybody who's attended. I'm so glad to be here with you all. And Kathy, masterclass, amazing. I really enjoyed your remarks. So I have some remarks, and then Maria, you'll screen share because everybody who's here gets a sneak peek at what will be officially launched in about a month. For those who don't know about the Westchester Community Foundation, we are a philanthropic charity that works to improve the quality of life for all in Westchester County. How do we do this? Through the generosity of donors who have established permanent funds with us. And from those funds, we make grants to high-performing nonprofits that provide programs, services, and work for better policies that create lasting change. When our donors established funds with us, they did so because they trusted the foundation to be future focused, working on long-term goals, as well as immediate needs. So we exist in a unique space. We're not the government. We don't replace government funds. We work alongside civil society and the nonprofit sector, but we do not provide programs directly to people. And we're a community foundation, not a national foundation, not a family foundation. So we have our gaze on all aspects of the community. We're looking at land use and environment and health and arts and culture. We're investing in everybody at every stage of their lives, even before birth and even to the end of life. So that's a big and ambitious charter. The story of the index came out of a desire to become more rigorous in our work to address health disparities. And we started to learn about social determinants of health when that was an emerging conversation, understanding that there are many factors that affect a person's really life expectancy. And folks may have heard the phrase that your zip code determines your destiny, and folks may have heard about the Opportunity Atlas. That caught our eye because in Westchester, one zip code can be very well-to-do and well-resourced with high income levels and great schools. And a nearby zip code can be poor, a high percentage of people of color, less resourced. And these communities can exist side by side. I'm talking about Rye and Rybrook next to Portchester, Tarrytown next to Irvington, Sleepy Hollow next to Briarcliff, Bronxville next to Mount Vernon and Yonkers, Mount Kisco and Bedford Hills next to Bedford. And because we're asking ourselves hard questions about the values and strategies for our work, we began to think more carefully about using disaggregated data to inform all of our work, not just health disparities, but investments in open space, in land preservation and air quality, educational opportunity, quality of life for seniors. So that's how we came to the Westchester Index, which will have 65 indicators grouped into 6 categories. We had a prior index which provided data that folks could search. What we found was needed was context for the data. What are we seeing? What does it mean? What are the trends? Where did the data come from? Because data needs to be understood and used appropriately. So for each of these 65 indicators, there'll be commentary prepared by the Center for Government Research, the CGR, that says, what does this measure? Why is it important? How is Westchester County performing? The county will be compared to neighboring counties, actually Putnam, Rockland, and Nassau, as well as to the state as a whole and nationally. And then notes about the data. There are 6 categories, and maybe Maria, if you want to share now, I can we can show folks, how the index will be presented. But the categories are children and youth, community, demographics, economic security, education, and health. And there it is. So this is a soft showing of the landing page. Yes, please just scroll down. There'll be mapping features. But first, so right there are the dashboards. Folks will be able to explore these dashboards. And if you keep scrolling, you'll see data points and trends, and scroll down just a little bit more. Folks can look at all indicators, and there you go. Folks can create a dashboard whereby they can compare, mix and match various types of indicators depending on what they're looking for across all of those program categories. And then in the upper right-hand corner, you'll see there's a link that's create a dashboard, mapping data. There'll be some maps for poverty statistics and lots of information. And that's not live yet, but just so folks can see and lots of walking folks through how to use the site. In summary, I just want to share that while the index was this particular index is specifically centered in race and ethnic disparities, with the desire and the hope to engage the entire community working towards equity. So it's a tool. I'm inviting folks, we are inviting folks to use the data and add the storytellings like Kathy just did, so that we can work towards some tangible outcomes and some goals to reduce gaps. And yeah, just yesterday, I was reading a release that proudly announced, a press release, that Westchester County ranks in the top 5 statewide for health outcomes and factors. And this was according to a survey of national county health rankings produced by the Robert Wood Johnson Foundation. And I saw that and it really caught my eye. Wow, such great news. But if you read way down to the bottom of the press release, our Commissioner of Health, Dr. Shalita Amler, was quoted as saying, and I'm quoting Dr. Amler here, that health inequities do persist, and that the county is working with community partners to address complex and difficult problems to help residents overcome the burden of poverty and health disparities. Our child poverty index and teen birth rate demonstrated stark racial disparities. 19% of Black and 18% of Hispanic children live in poverty, while only 3% of white children live in poverty. Of course, no child should live in poverty. So again, the headline was, wow, Westchester is doing great. I'm grateful though that our county leadership said, wait, we really need to drill down. We really need to see disparities, the gap. There was disproportionate needs on race and ethnic lines. So we are all working to understand data at a deeper level. And it's our hope that community stakeholders, municipal officials at the county and local level, nonprofits, our individual donors, and the funding community better understands Westchester County to take action that's focused and strategic to address these issues. Thank you, Maria.
Thank you so much, Laura. I can't believe we all just got that sneak peek. I think it was like down to the day we thought, would there be something to share? And I'm so glad there was. I put into the chat, everyone, the link to register for the full launch of that site in all its glory. It's still in development. That really was a treat to get to see what's coming our way. And so I do hope that you will share with your contacts and you yourself, if you have not already, please register for that. I'm so thrilled that Laura is on the center's advisory board and has been such a partner in how we're rethinking the racial equity scorecard that we're working on. And we're really looking forward to using as a baseline and as a blueprint, the community indicator project that the Westchester County Community Foundation has been engaged in. And just stay tuned for more on that. It will be coming out later on this year, and we're really excited about that. And so thank you, Laura. I'm going to invite to join us now, Ivy Cam. Again, I will put everyone's bio back into the chat in the interest of time. We won't get into it now, but Ivy Cam is the Global Director of DEI Sciences at Regeneron. And before you jump in, Ivy, as the note I wanted to make as Laura was speaking is that there are a number of community groups that have been collecting and sharing their own data around their experiences and how that adds up to discrepancies that we see playing out when we compare ourselves to our neighbors, right? And so I just want to honor right now, I don't know if she's been able to join us today, but just want to bring up the work that's been done by a number of folks. Over 10 years ago, the Westchester County African American Advisory Board, led by Barbara Edwards, did a blueprint for change. And if you look it up, you can read it and it doesn't feel like it was 12 years ago. And that is part of the story too, the rate of change when we can make progress, and what does backlash look like? And then and resistance to progress, how does that play as well? That's important information. And then I also want to lift up Cheryl Brannon, founder and CEO of Sister to Sister International. Many of you may have been there in 2019 when Sister to Sister released its Still I Rise report on Black women and girls in Westchester County. Fantastic data and information that was contextualized, and Sister to Sister International's working groups are still investigating those issues around juvenile justice, education, entrepreneurship, economics, and more. And so there's so much going on. And we're hoping that our work as the Center for Racial Equity and that hub pillar is inviting people to the table to share our information with one another and to learn from one another how that information can have a more data-informed decision-making process and community so that we can better advocate for ourselves and make the demands we need of those empowered to change our experiences. So with that said, and thank you for the space to dig into time for that, Ivy. So glad to have you here. Um, on the one hand, I can just imagine folks are like, there's always someone from Regeneron. Well, you know why? Because we're in deep partnership with Regeneron. This goes beyond the grant dollars. And I'm going to say that out loud. It goes beyond the grant dollars. Regeneron shows up on task forces. Regeneron shows up with their employees. Regeneron will invite us to events, will offer space in this very precarious time of the pandemic that we are still living through. So I really just want to thank you in that way, Ivy, on behalf of Regeneron, and give you some time here to respond to a question or two. So one, this role is a role I've never heard of before, DEI Sciences. So in your role as director, DEI Sciences at Regeneron and the co-chair of Regeneron's Asian and Pacific Islander Employee Resource Group, can you share how data is informing and plays into Regeneron's corporate philosophy of, quote, doing well by doing good, end quote? And can you give us any insight? Oh, sounds good there. Can you give us any insight on what the Regeneron DEI in Clinical Trials Task Force has been learning?
Great. Well, thank you, Maria, for having me here. And I just want to say that, we're so excited that, our partnership over the years, have, really brought to light, some of those issues that, I hear a lot of parallels and synergies between YWCA and the company in terms of advancing diversity, equity, and inclusion in our communities. And so it's interesting, my position, it's new because you haven't heard of it before because it is new. So we just started, this about a year ago and really investing in the way that, Regeneron being more mindful of how we develop our sciences in a way that truly is inclusive and equitable to all the patients that we're trying to serve in the world. And so to backtrack a little bit, the motto "doing well by doing good." I don't know if you've heard of it before in the audience. When I first started at Regeneron, I used to think, what does that mean? And so I've been with the company now actually for 9 years. So I'm a scientist by training. So data is something that I've always dealt with, in my professional career. So, as I'm invited to this panel today and really thinking about, how does data, something that we, tend to think of as objective, speaks for itself. Sometimes it's really colored by, subconscious or sometimes, intentional bias, whether it's by racism, sexism, or other forms of injustices. So doing well by doing good, as I've learned now, as it applies to data, for me anyway, really means, how do we as a company, that is responsible for, discovering and generating new medicines, think about how we're intentionally inclusive about the way that we generate this data that supports, our medicines in use in different diseases, and also in the way that we interpret them and we communicate them. In the way that they are as representative and inclusive, and in a way that's meaningful, in a way that's being received by the community that we're developing medicines for. So some examples that I like to give are, and I have heard similar comments by the other panelists, of how do we bring our whole selves to work and in a way that's meaningful, that we can contribute to the way that our company generates and look at data so that we can produce medicines that are relevant for everyone. So some examples that I like to think of are, during the pandemic, I think a lot of us, have the experience of, working from home, and the line between work and life has really blurred for us. And for me, I think one of the things that made me realize is I show up as work as me. The me that's in front of the computer is the same me that walks over to the kitchen and start watching news, as an Asian person, as a mother, as, a single mom. All these things converge in the way how I show up at work. So historically, I think sometimes we think of these things as handicaps, how, I have to put those things aside, as I come to work. But at Regeneron this last few years, I think a lot of us have come to the realization that, those are the parts of you that, can contribute meaningfully to your role. And some of those examples are, there's not race specific, but in terms of inclusiveness of our neurodiverse colleagues. I know historically, a lot of neurodiverse colleagues come to work feeling like that's a handicap. That's something that, somehow they have to mask. But then, one of the examples I had this last year was someone actually came to me and asked me, is there anything that we can do to help improve the way that we include neurodiverse patients in our clinical trials? Because, a lot of the processes are pretty complicated. Explaining to someone what informed consent means, what are the risks and benefits? Documents are long, lots of words, and historically, we realize that neurodiverse patients or neuroatypical patients sometimes are subconsciously selected out of clinical trials, not because they're not suitable, but because they cannot participate in the informed consent process as effectively. And so, I just happen to remember that we actually have an employee resource group that help our colleagues who identify with mental health issues or being neurodiverse. And we reach out to them, and they were so happy that this is a time for them to contribute, their, personal experience, their lived experience, so that Regeneron can be more intentional in the way that we generate the data that we have in developing our medicines to consider their experiences so that when the medications, come onto the market, they are inclusive of these patients that, may come from a different background or have a different perspective that traditionally may not be able to participate. And as employees, it's super, for myself, as an Asian person too, we've had the experience of being able to review some of our multicultural marketing data, marketing material, because, the data, the information that we produce and the way we communicate them, in the mainstream sometimes cannot be received in a meaningful way by patients who do not speak the language. So, traditionally we translate these material, we put them out following data. We have data where these patients are, but at the end of the day, are they being received effectively? So I know that as part of the API ERG, we actually reach out to our members, those who are more recent immigrants, where Chinese, Korean, Vietnamese are actually their primary language. At work, sometimes I know that some of us feel sensitive about not being able to speak English perfectly, and because another language is our primary language. But these are times that we can actually contribute, our language expertise, a cultural perspective, in making sure that, the data that we produce, the way we communicate them is actually meaningful. So we've had instances where we review this material and we can say, yeah, it's factually correct, the data is right, but the way that you deliver that data, the message, is not culturally appropriate. You would never say that, in Chinese, and they will be misinterpreted. So that's a way that, we feel like, we, as employees can really contribute to the company doing good in a way of saying that we're inclusive, in the way we generate data, we communicate data, and doing well, meaning the company will, have sustainable long-term growth will naturally follow. So that's what we mean by doing well, by doing good. I know that we're running short on time, so to answer your second question, clinical trials, and it's a huge topic. We can spend days talking about that. But I touched on some of those points earlier that, the way that we traditionally, do science, sometimes we subconsciously neglect and leave out patients that don't have access to either healthcare or to clinical trials for a variety of reasons. A lot of times, these subconscious bias are unintentionally baked into the way we design our trials. Maybe there are too many visits that patients need to take time off work or find childcare to go to. And so we subconsciously select out patients who have the resources to participate in clinical trials. We're not, conscious about it in the past, but, we're trying to be more mindful. Patients who may have a historical mistrust because of systemic racism in the past that, may not even want to hear about it or just don't have the understanding of it. And physicians who may have, certain stereotypes in their mind that think, oh, maybe I should not reach out to these patients because they wouldn't understand. So those are all the different barriers that, we are growing more aware and conscious of and are actively developing strategies so that we can be inclusive, we can be diverse and equitable in the way that we approach science. So there are many things that, we're doing. Hopefully we have another chance to continue that dialogue. But, one of the things, and that's on the last slide here, is, trying to reach out to the community to really understand, what are some of the barriers, what are some of the concerns, of either not understanding the process of clinical trials, or not being aware of what is out there that's being available to our patients. So we actually is our Black ERG actually that connected us to the community organizations. YWCA is one of the partners of this program. Yeah, there it is. And so we invited speakers and experts in the Black community that come from the trusted organizations, from patients, who are asking to hear from these particular speakers and experts. What does that really mean to participate in genomics research and clinical research? So that's another way that, we are trying to connect with the community so that we're not developing our science in a vacuum, that we're really taking in diverse opinions, lived experiences, so that we can be as diverse and equitable as possible in the way that we generate our science. So thank you, YWCA, for being one of the partners of this program. And I look forward to many more opportunities to continue to partner with you and to continue to have a dialogue with our participants here. So thanks, Maria.
Ah, am I unmuted? Okay,
Yes, we can hear you.
great. What is fascinating, here's a fun data point. You can hear me and it still says on my machine that mute is not, like, something interesting is happening. So thank you for letting me know you could hear me. Um, I and thank you again for the partnership and for your response to that. What is jumping out for me really, really loudly in what you were just saying, and also coming through what Laura and Kathy had mentioned as well, is the incredible importance of trust. Trust between patient and provider, trust between community and medical industry, trust within communities of color, and throughout, right, our greater humanity. And so I don't think it was just until I thought of it that way that I said, this is the center's role in all of this. This is why anti-racist approach to data kept popping up, because the undone work that we often tend to rush over to get to the quote equitable outcome is the incredible work of healing, right? And if data, and I used to be on the board of Data for Black Lives, which is founded by Yeshi Milner. If data can be weaponized against you, if it can be a barrier to your thriving and your lived outcomes, then you start to resist anything that shows up looking like an imposition of data. Anytime a doctor comes into your hospital room and says, we've got this thing going on in the hospital and you seem like a good candidate. If you sign this form, we can tell you more about this research our students here are doing. More often than not, folks who come in with a distrust for the hospital in the first place are not going to sign up to be, quote, a guinea pig, right? To be part of these explorations and experiments that people across the board have been abused and harmed by. And so there is this amazing body of work that Kara Page has really put out there and catapulted, Healing Justice. And I know Regeneron as a pharmaceutical company, a science-based company, it sounds like you're doing some of this work internally with your clients and with your employees and looking for ways to engage community so that you can have science that is based not on the racialization of science as an industry as being oppressive and extractive from communities, but really being a partner, which is such an interesting and really encouraging model to go working toward. Wish you luck in it. It's going to be really hard, but I hope that in some of the ways the center can be a partner, it can also be in facilitating conversations of healing and bringing healing justice to the forefront of that work. So thank you, Ivy. And we could have a whole other conversation just about disaggregated data and clinical trials and all that comes within and between those two things. I know we could, and maybe we will. Maybe that's one of the things we could do next. I'd invite these panelists, Laura and Kathy, to come back on camera for some final thoughts. I just want to name that the time on my clock says 1:01 p.m. Eastern, and the flyer for this event said we'd go all the way till 1:30, but I want to tell you what that can look like. One, if you do have any questions in the audience, please drop them in the chat. And if you do not, that is also fine. And that one of the things we aren't getting the chance to do because this is virtual is just kind of hang out with one another, say, this is what I heard when they said this, or what were your thoughts? There's no coffee table that we can hang out around and chit chat about. But if you are open to staying until 1:30, I will keep this Zoom open and invite you to join in breakout rooms. I will stop recording for that. So you should feel hopefully more open to share your thoughts with one another about this topic. And that's an option. It's an invitation that I hope you take me up on. But before we officially close the panel, I want to bring back Kathy and Laura. And something is definitely up with my machine. I cannot see anyone. I'm going to give you the data. I'm going to give you the information of what's going on. I cannot see anyone, but Laura, I think you're a co-host and might be able to spotlight yourself and Kathy, add the spotlight.
I'll
That's,
try.
I'm trying to think of all the different ways I could do this, but my machine is barely holding on today.
I can remove all spotlights and we all see each other. Do you want to try that, Maria?
Okay, sure. That's great.
Okay.
And then you and Kathy come off mute and we can just take this final question.
How does that look?
Oh, we all look so great. Those of us who are on, we all look so amazing. Okay, so lots was said and lots to dig into. And this is something I do every once in a while when I'm moderating a panel, rather than have like final question or final thoughts. I'm curious, and if you're all up for this, this is how we'll close this. We'll close this with the uncertainty of questions, more questions. I'm curious if, as panelists here today, sharing so much about what you do and what you know, if anything came up for you based on what someone else had said that you want to pose a question to. So, you know, if Kathy has a question for Laura or Laura has a question for Ivy, I am curious if I just want to leave a little space for that before forcing more of like, you tell us out of you. I'm curious as to what you are all curious about at the end of this panel.
Well, I loved, Maria, what you said at the end, building on Ivy, what you had talked about, and this theme and thread across all three of us around trust, around building trust. And it does strike me that trust can come from healing, and healing can come from trust building. And is that a virtuous cycle there? That as the center focuses on racial healing, is there a way that that can also contribute to racial trust building and really building towards the beloved community? So I think you're onto something there.
Thank you, Kathy.
I have a similar thought, as I was listening to Laura's discussion of the dashboard, and I was like trying to copy down the website. I know it's not live yet, but I'm really curious. I'm actually physically based in California, and our company obviously is in Westchester County, but I live in Oakland, so I hear, and I think Kathy as well, so in
Mhm,
California. So,
mhm.
I hear a lot of parallel, of the diversity even within our own city, our own community. And so, and it's listening to the data that you presented, that, the Y is really digging into about the demographics, disparities, and knowing that, Regeneron is, one of the largest employers, right, in the county. What, like in my mind, I'm just thinking, what can we do to continue to partner, now that you have the data? What are some areas that you guys see Regeneron being this huge entity in the county, in addition to the grant coming onto these discussions? What are some of the other ways? And maybe this is a completely separate discussion, but in my mind I'm just thinking like, what else can we do based on the data that you have now that would be really meaningful to the community, that along those lines of building trust, right? Because we're a pharmaceutical company, you're here to make money, right? So how do we continue to facilitate the building of the trust so that we can really partner, to truly bring medicines in a meaningful way to all our communities?
Yeah, I mean, what a great question. And I'll just jump in. Sorry, Laura, I just like before I lose it, the thought, because that happens a lot. Um, the thing that jumps up for me is like, I believe Regeneron itself has some data, right? Maybe about this community, maybe about the um, the process of recent clinical trials that have been done. What are you learning as you look at your own data that can
Hmm.
inform not only how we get more people involved and willing to consider participation, but is there a way around the storytelling of of what's going on that not only you giving us, but having a community conversation about the narrative that needs to come out of that, right? Because if we look back at the definitions before, the data is the pieces, it's the stuff.
Hmm.
And then we put it together and we want to have this informed conversation, right? We want to share this information. And what we know is we all don't receive information the same way,
Hmm. Right.
regardless of our race. Like even within and across races, we just receive the information differently. In my one being as a person,
Hmm.
my husband has had to learn, if I want Maria to remember what I'm saying, I have to say it before 10 o'clock in the morning. Because after that, her day has started and I am just talking to myself, right? Like he had to learn that. And I would say, well, why? But I'm just one person and that makes a difference, right?
Yeah.
So I think of the people who are really committed to getting our attention, right? Social media influencers, big corporations, they're analyzing data all the time in a very serious and rigorous way. Target knows when to send that email to your inbox. You're
Hmm.
not waking up to an email Target sent you at 2 a.m., like the can't go to sleep person in your office. Hi, that's me. I'm not calling on anyone else. But Target knows when to tell you to use your bullseye points and when the thing is going on sale. It knows you, right? It has your data and it knows your profile. And so I'm wondering about how we can get that level of rigor and trust building in bringing the community in to have what would definitely be a courageous and perhaps clarifying conversation just about what data Regeneron can share,
Yeah.
right?
No,
Knowing that
absolutely.
people are coming in with heavy distrust, right? And knowing that you're taking a brave, vulnerable position, even releasing that data. But how, that's what I'm thinking. How do we structure a
Hmm.
conversation or series of around that where people feel a part of the process rather than a point in the
Right.
process?
No, that's really great feedback. And though my mind is already turning about like, oh, all the things that we could do. So
Ivy and I are having lunch next week. We'll get back to you,
we will,
everyone.
yes. No, but I think that those are crucial, right? Like, how do we, continue to understand our responsibilities, right? Being transparent and, being responsible not just to your patients, but our employees, our workplace, our communities in the Westchester County. So, and I am so passionate about the way that we do clinical trials. I come from, a science background in our clinical trial department, and so I love to talk to you guys more about that, and how to be a more active participant, in our community, to demystify some of those concepts about clinical trials, providing as transparent information as we can so that we can truly have the trust that we are each other's partners, and we're not just utilizing each other's in these transactions to produce medicines. So yeah,
Yeah,
definitely open to having those conversations.
thank you. Thank you so much. And Laura, your question or comment before we take two in the chat.
I will share, thank you. I will share a hope and a vision that Westchester's business community, starting with Regeneron, and residents can all sign on to using data to deliver equity really precisely. And that means getting over fear of data, which I, admit to have, that we all can be data scientists for equity. And what does that look like for us all to do that together? And I think it does go back to trust building and saying, okay, um, it takes time to commit, just like it takes time to commit to racial justice. It takes time to commit to understanding data and looking at it. Start somewhere and do it with others so that we can really move things forward. That's just an observation, but it's a bit of a hope too. So.
Thank you so much for that. In case you haven't heard me say it before, my mentor in my head on abolition, Mariam Kaba, always says hope is a discipline. And so to have that hope and to act, it's a discipline, right? To just keep on hoping and working toward that hope. I think that it sounds to me a doable thing to have a commitment of that from the Westchester business community specifically. So I do hope we see that come to pass. I'll take these three questions in the chat. One, I think, Laura, you might be able to answer. So this person works in Rockland County and lives in Orange County. Does anyone know who is doing the same work in these counties?
I don't know if anybody is doing this work. I'm starting to connect at the national level with other community indicators sites. And I can send that person what I know of, but I have not heard of community indicators sites for those counties.
Got it. And sometimes the reality is it might be there right under your nose or it's not there. And hopefully by doing this here in Westchester, you're able to present to members of your community and leaders that it's doable.
There is a Mid-Hudson community profiles, and I know Robin's on this call, so she can probably find the site. There is one for the Hudson Valley, and I'm not sure if it includes Rockland, but there is one. I just, CGR built it, so we can get that to them. So I stand corrected. Correcting myself.
Awesome. Thank you so much. Another question. Oh, look, I have the power to do things again. All right. Look at this. Wow, it's fantastic what can happen. And then Laura. Laura, can you say something? Did we lose Laura?
I was looking up the site for the Mid-Hudson community profiles to send. Here it is. I'm going to drop it in the chat.
Okay, great. Great, and all of us are pinned. Man, fantastic. So we've got a few more questions. This one, I know this name, Allison Lake. Are there any comments about how leaders are addressing, hold on a sec, leaders are addressing how imperfectly collected data impacts artificial intelligence, which, let me tell you the truth here, guys, I do not have, okay. Artificial intelligence, which businesses are using to determine things like mortgage loan access and schools to determine students are at risk. So I'll say that again because it's in the chat, but I'll say it again. Any comments about how leaders are addressing how imperfectly collected data impacts artificial intelligence, which businesses are using to determine things like mortgage loan access and schools to determine students are at risk?
So I think at the federal level, although I think I saw Christian Templeman just turn his video back on, but I think part of President Biden's work on disaggregated data is covering all of the federal agencies. And Kathy, maybe you know a bit more about that, but I bet Allison can access some of that work through the White House, right?
Yeah, no, very much so. There's a equitable data working group
That's it.
that just on April 22nd, so just last week, released its recommendations, and it's across the whole of government. So really talking about, and this actually hits both questions, not only of this one, imperfectly collected data, but also kind of who decides what data points are and how those are defined. Now, in this case, there's kind of three worlds of data. If you think kind of at the national level, there's public data, which the White House and the federal government, especially driven by the US Census Bureau and the Office of Management and Budget, kind of sets the frame and definitions of kind of how data is defined. That certainly is in interaction with professional organizations like the American Statistical Association and kind of people who are data scientists. But really what the census establishes becomes literally the denominator for everybody's data, because that is considered kind of like the data of record about at least all of our demographics. So as the 13 federal statistical agencies like move in terms of like societal changes, they're the ones who will determine, oh, will gender start to be defined more than just in a binary? What might that look like? Even among racial categories, the largest racial category in the country is being multiracial. That's everybody, like, in whatever form and whatever combinations there are. And the Census Bureau hasn't caught up to figuring out, like, how do you capture that? And how do you capture that in a way that really reveals, like, as I said earlier, people's needs as well as their gifts, right? So that's still needing to catch up. And then in terms of, so I don't know anything about AI. So that's just like a whole nother world that I don't understand. But even how data has been collected for the last like 200 years really will determine, especially at the federal level, those data collection standards really determines what those denominators are. And so we just need to keep pushing our federal agencies as well as our state and county data around how they collect the data. So just one little tiny granular example. The death records the race in death records are determined by funeral directors. And the funeral director can't ask their client what race they are. So they're the ones who put down the race of the deceased, unless somebody else comes back around, like a family member, and kind of corrects it. So depending on what county you're in, depending on what state you're in, there might be like just two categories, like black and white, or maybe three other states or counties, there might be more categories, but that determines the death rates among all of us. That's really a judgment call on the funeral director. So things like that, it's at all levels that really determines a lot of these things.
Wow, I did not know that. And I don't know if I also see Chris Templeman off camera. I don't know if Chris, you want to add to that piece around, well, I think it was the question around using things to determine like mortgage loan access or others, but just want to pick up on that Laura had mentioned. You come off camera. Want to make sure if you have something to add to the conversation, you're welcome to.
Yeah, no, thanks, Maria. Sorry, I just had to step away for a second. But in terms of mortgages, that's not a direct area for me. Our private bank handles mortgages, so I don't do that much with mortgages directly. But the thing I do a lot is access to the capital markets and really trying to break down barriers to different things. And the primary barrier that I'm really focused on has really been access to the capital markets to an employer-sponsored retirement plan. And a lot of that has just been just sometimes unconscious bias. Sometimes you have employers that for whatever reason think that people won't participate in a retirement plan. And so the thing that I think is a very helpful tool is automatic enrollment inside of an employer-sponsored retirement plan, and that compounding effect of being in the capital markets, especially at an early age, can provide opportunities if there's a loan provision inside of that retirement plan that might allow somebody to help utilize some of that for a down payment for a home. And that really helps make home ownership a little bit more accessible. But that's really the story that I'm talking about the most out there. And then the last thing, it's sort of like not really spoken that much about, but states around the country are starting to implement these employer-sponsored plans that are IRA based. So if you're a small business owner with a certain number of employees, that's going to be a state mandated thing. So whether you're a bodega, a restaurant, if you have 5 or 10 employees, it's still being sort of finalized in New York State that you're going to have to offer this retirement plan. And I just think the compounding effect of that will be very helpful when it comes to home ownership and just creating wealth. And I do believe that's a contributing factor when it comes to racial equity.
Thanks so much, Chris. And for those who don't know, Chris is one of the 30 members or more of our advisory board here at the center. So very grateful to have his input here. There are other advisory board members on today as well. And thank you all for being here. There's a lot in the chat, but I'm going to get back to one more question. It's 1:25 now. And I saw a question about how can we influence who decides about a data point and how it is named. For example, who decides if a quote sex data point is a binary male, female, rather than gathering broader nuanced responses. And I'm happy to kick this off because this was a story I shared as well. Going to my daughter's pediatrician, shout out to Village Pediatrics right there in Tuckahoe, where I went to elementary school. So was at Village Pediatrics and got the form, you get, there's so many forms all the time. And so it was the most expansive form I had ever experienced in a medical office. It asked what sex my daughter was assigned at birth and how would I characterize that now? And so many options, right? I don't even get that many options when I go to the doctor. My daughter's 6. This is a pediatrician's office, right? I was so pleased. I was so completely pleased, and then realized, wow, this might really like tick off other parents, right? Who can't believe now they need to have this conversation with their child at the pediatrician, right? Like my daughter couldn't read all of that. But what if she were 11 and could, right? So I think there are places in our lives where if you have the control to decide how you collect your own individual data, that's on you. And you should think about that, right? And then other places where it gets bigger and broader, where we really do need to ask who's making these decisions. And so that's just a local example that I love. And I'll pass it on to Ivy, who has her hand up to respond to this.
No, thank you. I was like, what you're talking about just, make me remember the previous question and how it's related to this one. So there is so much when we talk about data and how we use data to inform our actions every day. Um, the constraint of binary data is that it is not descriptive, is not nuanced in describing everything that make us us. So in your example, Maria, your daughter's pediatrician office collect all of this data, right? So at the end of the day, how are they going to integrate all of that to inform the care about your kid? And is there a way that, we can, better understand how we provide medicine? So precision medicine is in a sense, how do we integrate a lot of different data in a non-binary fashion so that we can generate a set of recommendations, information that will help us choose better actions, for our health or for other things. And that is artificial intelligence, and part of that is machine learning. So, machine learning, artificial intelligence, the intent I mean, in itself is not good or bad. The intent is to be able to digest and integrate a lot of this information from a lot of these different sources so that we can make more informed decisions. The problem is, to that question is, um, sometimes, the output is not accurate. Well, the reasons are they're twofold. One is when the algorithm itself is not fair or accurate or have baked in subconscious bias. So how do you weigh the different factors, right, that goes into your output? And two, and some of you may have heard this term before, garbage in, garbage out. So, is a IT term that describe how if the input of the data is imperfect, your output is going to be imperfect. So, we actually, to your point, Maria, in the way that we do clinical trials, we're actually now assessing how do we incorporate machine learning so that we have a better way to integrate a lot of different data so that we are generating more useful information out of all the data that we can collect out there. Uh, but keeping in mind those caveats. So I would say that for all of us who encounter AI, machine learning in real life, one, don't be afraid. It's just a fancy math equation. You put data in and it put recommendations out the other end. Just be mindful of the two things. One is who generates the algorithm? How is it written? Is it written in a fair and equitable and accurate way? And two, where is the data input? Where does data come from? If you're only generating or inputting data about one group, is it generalizable to everyone else? So those are the things that I would encourage everyone to keep in mind, as we encounter, discussions about AI and machine learning and how there could be subconscious bias baked into it and how you can kind of encounter it by unraveling, what that really means. I hope that's helpful. I'm sorry, I'm a
That
data
is,
person.
no, it's fine. Just at the last minute, want to ask Laura if there's anything to add to that, just given what we've discussed about the journey of the health index to community indicator project, this idea of like who's making these decisions about the data points and how do you access them?
Yeah, and I just have had a question about that as well. So the Community Foundation's board and staff worked collectively on the decision as to which data points out of thousands of data points to include across those 6 categories with the guiding lens of race equity and ethnic, of racial justice and ethnic justice. So that working with CGR, wherever the data could be disaggregated along race and ethnic lines, we prioritized including that in the list. And then we looked across all the categories to see where there could be complementary. So for instance, there are environment factors too. We have air quality there, access to open space, use of transportation, all kinds of data and thinking both within the categories as well as holistically. So we decided, with a lot of guidance from CGR, which has worked on so many of these, including those Mid-Hudson profiles that were shared in the link, as well as a couple of years of planning and guidance from community indicator projects in upstate New York and other places as well. So really trying to learn from our colleagues and peers, but thinking specifically about race equity here in Westchester County and what we knew, as in my earlier remarks, about particular villages and subparts of communities. Greenburgh, the town of Greenburgh is a pretty complex place, right? So sort of disaggregating within, like we love Greenburgh, but, let's really look more closely in terms of geographical lines. So I will say come on the 25th and we welcome feedback from the community because we're going to launch it and it's really for folks to use and provide feedback as we move forward.
Maria, I'm so sorry. I just wanted to say something to Laura. As a lifelong resident of Greenburgh, I call it Greenburgh proper because I live in Fairview.
Yeah.
And then they have the unincorporated town, which has all of these towns and villages. As you said, as I've gotten older, I've started to think about how do these other towns and villages impact the policies that the town board enacts in Greenburgh. and who are the most influential people, you have the town hall in Fairview, which is a large Black and brown community, but most of the outlying villages and things are not. And who are you actually doing whatever decisions you're making, who are you actually making them for? I just wanted to say that when you said Greenberg.
Yeah, I saw you nodding, but yes, there's a lot going, including Edgemont. There's a lot going on in Greenberg. Lots of conversation to explore.
Mm-hmm.
I am encouraged by all the thank yous and gratitude, and could stay on and talk about this, hear about this all day. I cannot stress enough what a calculated risk I took saying we're going to talk about data. But so many other things we could talk about to take a stand against racism. But there's a comment that I'll use to close us out. And Anne asks about the census and why the Office of Management and Budget didn't meet the cutoff date. And Kathy had been talking about, this is our baseline data. And Kathy, and if you're from Mount Vernon and saw me in 2020, you know, I was basically like, census obsessed, I will admit it, because it is our baseline data. And there are some groups of folks who are consistently undercounted and therefore underrepresented. And the other side of it is an overrepresentation on another side of folks. And this little piece of information I just got about funeral directors and how COVID data from patients was taken differently from different states. There were just, people were just making stuff up. I don't need to know who you are, just, or I need to know everything about you. There's so much. And so I'm just really glad that when we reach out and say, let's try something, folks are willing to take the ride. I think we could have a whole data series. And I want to thank the panelists for being here. I want to thank my colleagues at the YWCA as we celebrate another Stand Against Racism event and day. I heard yesterday the CEO of YWCA USA, Margaret Mitchell, say this is an opportunity for us to recommit and find new and deeper ways to be committed to being against racism, to be anti-racist. And so I invite all of us here, either watching live, joining live, or maybe you're watching a replay, just take that minute today and really think, how can I recommit, or what are my own personal anti-racist practices, and what's my anti-racist vision for the world and my community? And I think I'll give last word, not to myself, but to County Legislator Jewel Williams-Johnson, who has a hand raised. And so again, lastly, thank you to my panelists. And Legislator Johnson, if you would like to speak, the floor is now yours, and we'll close.
Oh, wow. Thank you so much, Maria. I only raised my hand because I am driving, so please don't let this be the last word. I raised my hand because I want the young lady that spoke about the makeup of Greenberg, just wanted to extend my assistance in helping you understand the breakdown of Greenberg and the leadership of Greenberg, since that is the major part of my district. Please reach out to my office anytime. Happy to help with that or anything else. And Maria, you know how I feel about you. There are no words. Your integrity, dedication are beyond. Thank you for this. The panelists were absolutely awesome. The discussion was even higher than that. Thank you so very much.
Thank you so much. I love to see an elected official be available and reach out to a constituent in real time. And with that, let that data speak for itself, everybody. Have a wonderful rest of your day. Thank you for joining us. Happy anniversary to the Center for Racial Equity. See y'all next year or before that. Bye.
Thank you. Bye-bye.